Good afternoon, everyone. Today I'll be presenting my work on algorithmic bias in AI healthcare application, focusing on the ethical implication and the expanding role of nurses. My analysis especially highlights how does issue show up in Los Angeles County and what they mean for clinical practice and patient safety. My term paper first explained how artificial intelligence or AI is used in modern healthcare and why it has become an important tool today. It also reviewed the gaps and challenges that exist, include issues like data inequality, algorithmic bias, and ethical limitation. Then the discussion covered the key stakeholders involved, such as healthcare facilities, policy makers and government leaders, technology and software companies, insurance providers, healthcare workers, patients and their families, community health organizations, and Los Angeles County Department of Health Service. Next, the paper examined the roots of algorithmic bias, include data bias, design bias, and implementation bias, and it presented strategies to reduce these problems. The importance of nurses was highlighted, especially their role in ensuring safe and ethical use of AI and the need for proper training for nurses in this area. The paper also described opportunities for future research. Finally, the conclusion emphasized that although AI can be very helpful in healthcare, without a strong ethical oversight and responsible management, it can also become a source of harm to the community. Artificial intelligence in healthcare refers to computer systems that analyze large amounts of data from imaging, labs, and electronic health records to support diagnosis, risk prediction, and decision making. However, many of these systems function as a black box, meaning we see the inputs and outputs, but not how the algorithm arrived at this decision. This lack of transparency creates ethical challenge regarding accountability, especially when biased decisions affect patient outcomes. People talked about smart computers a long time ago. These really strong ones only started working in hospitals in the last 10 to 15 years. Now nurses and doctors use AI to help find infections, read x-rays, and write notes faster. But we still have to be careful because sometimes these computer helpers say things that are not true. In California, especially Los Angeles, we use AI a lot in big hospitals like UCLA and Cedars-Sinai. They use special computer tools to help take care of many different kinds of people. But LA has all kinds of families, different languages, skin colors, and neighborhoods. And sometimes the computer helper doesn't understand everyone the same way. That can cause unfairness. People like using AI because it can make work faster. It can help doctors and nurses when they are very tired. It can help people who live far away or don't have a lot of money. But AI also needs to be fair to everyone, not just some people. The big problem is called bias. That means the computer helper is nicer to some people and not as nice to others. For example, sometimes It works better on people with light skin than people with dark skin because it learned mostly from light-skinned people's pictures. Sometimes it thinks a patient is not very sick just because they didn't spend a lot of money on medical care, which is not true or fair. These mistakes happen because the computer only learns from the information we give it. If the information is missing or only shows one kind of person, the computer learns the wrong lessons. And if the people who build the computer don't know much about different cultures or different patients, it can make even more mistakes. And when hospitals have older computers or fewer resources, the AI might not work correctly there either. To fix this, lots of people have to help. Hospitals have to make sure their data is good. The government has to make rules so AI is safe. Insurance companies have to make sure they don't use unfair tools. Patients and community groups have to speak up too. But nurses are the heroes in this story. Nurses are the ones who stay with patients, see them every day, talk to their families, and know when something doesn't seem right. Nurses can say, hey, the computer said this, but my patient looks different. Nurses protect the patient and make sure the computer doesn't hurt anyone. Nurses also help teach others how to use AI safely. To keep everyone safe in the future, nursing schools have to teach students about AI. Students need to learn how to understand data, how to think carefully, and how to spot mistakes that the computer might make. They need to learn when to use the AI and when to say, no, this doesn't look right. AI can also help students practice in simulation. There is still a lot we don't know. We need more studies that look at how AI works for different kinds of people. We need better rules to keep AI safe. We need nurses to lead search and help fix these problems. In LA County especially, where many families live with barriers like language or money, we need to make sure AI helps them, not hurts them. In the end, AI can be wonderful helper. It can make her faster and better. But if we aren't careful, it can make things unfair or unsafe. That's why nurses, leaders, teachers, and communities have to work together to make sure AI is honest, kind, and fair for everyone.